Okay, back by popular demand, Dr. Tom Lomax. Welcome back to the show, Tom.
Thank you. Nice to be back.
So for anyone who's not familiar with Dr. Lomax and who hasn't already, go back and listen to episode number 1, the very first episode that we did of the show, and you can find out a little bit more about Tom and also listen to his very helpful advice on cuff and shaw. So today we're going to be talking about health checks, which is part of Japanese life. It's not a regular part of a normal procedure performed in a lot of other countries. So people who are new to Japan may not be familiar with this type of health check done on an annual basis, and may wonder why, once a year they're instructed by the companies to, in some cases, take almost an entire day off to be shuttled around various tests, almost like a factory line, and then given all this information and told that 5'11" and 78 kilos that they're morbidly obese and have to lose a bunch of weight. I guess we should probably just go back and talk about the history of the health check and how it became a part of Japanese society and part of and how it became a regular procedure here.
Yeah, so thank you, Sam. As you said, it's an annual thing, and it was actually a legal requirement. So if you're an employee at a Japanese company, you have to do an annual health check, and you can actually be disciplined and I believe even fired if you refuse to do your health check. And companies from their side are heavily incentivized by the government to get everyone to do a health check. Large Japanese companies receive government support in different forms, and some of that support is conditional on a certain percentage of their employees having completed an annual medical check, which I think is sort of over 90% or something like that. So if you're in a larger company, human resources will be chasing you to do your medical check if you haven't done one. Smaller companies, perhaps it's less important, but it's still kind of, implicitly expected of employees. The health checks kind of grew out of tuberculosis screening. So if you go back to the immediate post-war period, one of the main health issues in Japan was tuberculosis. And a quick practical way to screen people for tuberculosis was to make everyone do a chest x-ray once a year. So basically other things have just been added into that. And even if you just do a very basic health check now, so the sort of very bottom end health check will always include a chest x-ray, blood pressure, a limited set of blood tests, and I think probably eyesight and hearing tests. And then there are sort of increasingly more elaborate health checks that add more things in. But historically, it started with the screening chest x-ray. And you could make an argument now that actually a lot of people don't really need a chest x-ray because tuberculosis is much, much less common than it was back in the 50s. Nowhere else in the world with the level of tuberculosis that Japan has would mandate a yearly chest x-ray. So that's almost a historical remnant, but I think it's the one thing that you're really not supposed to skip on when you do your health check, actually.
Right.
That's where it came from anyway.
Yeah. And for people who haven't done a health check in Japan as yet, what can they expect?
It's quite an automated process. So, there's a sort of standardized menu of checks that's usually been sort of pre-selected for you. The amount of time, I think the one thing that people usually comment on if they're new to Japan and it's their first time doing the health check is the amount of time discussing things with the doctor is very limited. And it's not really a forum to discuss your wider health concerns. So I guess if you did a sort of private medical examination in the States or, in some parts of Europe, you'd have quite a lot of time to discuss any health concerns, and doctor might be prepared to sort of bring in additional measures to check out problems that you've got. There isn't really that expectation in Japan. It's quite a sort of brief interview, just quick check that you're feeling healthy on the day and don't have any significant medical problems, with no expectation that you'll go into a lot of detail. And then you're sort of sent round to do a whole bunch of tests. So if you do a medical check at a larger facility, one of the big hospitals, so have a dedicated circuit and you'll just go from one station to the next. And then when you've completed all the stations, basically you check out, you might have a chance to review some of the measurements or blood tests, or they might just be sent to you in the post. And again, I mean, the variable part is if you don't speak Japanese, when you get the report, I mean, some places are starting to provide English translations, but quite a lot of places don't. So you may get a report that's basically a document that's all in Japanese. It's quite hard to navigate. And just for every sort of section on the health check, so, you know, for blood pressure, for lipid metabolism, for blood sugar, liver, kidneys, you just get a letter. And that letter is usually graded A through to E. So A is like, you're fine. B is there's a problem, but you don't need to worry about it or do anything about it. And then C through to E are, there's a progressively more serious problem and you need to seek help, you know, with increasing urgency. So E means you need to go and see someone right away, basically.
Right. So it's essentially a report card.
Yeah, basically, yes. It's like your school report, isn't it?
And how long does this process typically take? And when you say that the results are often sent in the mail, how long does that process take when compared?
I mean, again, that's quite variable. I mean, I hear of people getting the reports anything up to a month later, but it should usually be sooner than that. I think places that provide an English translation historically weren't necessarily very good at automating that, so that might have built in some delay. And the actual doing the whole thing, I mean, if you do a very basic medical, you might be in and out in a couple of hours. But I mean, as you say, some of these very sort of top end ones that are billed as being like executive or VIP medical checks can take a whole day.
Yeah, yeah. I can remember one person mentioning that they were given a couple of E's on their report card, that something needed to be done drastically, very quickly, but that didn't come through for another 5 weeks. So
right, yes. So
had to question the urgency there.
Yeah, I mean, sometimes I hear of people being contacted directly because there's something very serious, but that seems to be the exception. I don't hear that very often.
And with those results that one might receive, are there particular results that people should pay attention to, and then other results that perhaps aren't as important? I mentioned at the start the weight one always comes up. People come out of those medical checks being made to feel overweight. It doesn't seem like those measurements, I'm not sure, is it based on BMI?
It is based on BMI, but I think it's a sort of mistranslation. In Japanese interpretation of BMI, anything above 25 is defined as obese.
Right. Okay.
Right. Whereas in the West, BMI is graded sort of 19.5 to 25 is normal, 25 to 30 is overweight, and 30 plus is obese. So, I mean, if you're fairly athletic but have a heavy build and do resistance training, you might have a healthy BMI of 27 or 28, but have, be basically quite lean. And you'll be told you're obese, which, again, some people kind of get a bit upset by that. And perhaps it's, mislabeling, I suppose.
Yeah, yeah. And with the other results, what are things that people should be looking at?
I mean, there's a few things that that come back time and time again. Kind of interethnic differences. So, for example, the main measure of your kidney function. So I think pretty well any medical check you do, they'll want to assess if kidneys are working or not, which is a very reasonable thing to check for, because the early stages of chronic kidney disease can have no symptoms. And if you can pick people up who've got early stage kidney disease, you can do preventative things to stop it from getting worse. So the main blood test we use to assess that is your creatinine level.
Yep.
But creatinine doesn't only depend on how well your kidneys are working. It also depends on your muscle mass. Yeah. So if you've got very low muscle mass and your kidneys are working fine, your creatinine will be very low. Okay, maybe like 0.6, for example. If you've got completely normal working kidneys, but you've got quite a lot of muscle mass, your creatinine might be quite high. And I mean, particularly you see that in people of African ancestry as well. So, you know, you see some West Africans who might have a normal creatinine of 1.4, but for Japanese people, that would always be high.
Yeah.
So a lot of people who are basically bigger guys who just have normal kidney function, but high muscle mass will always get flagged on that. But there's no explanation. It just says, you know, your kidneys are graded like C6, which means you've got to get them rechecked within 6 months. Or even I've seen D's come back. And then when we've looked into it, kidneys have been completely fine. It's a big guy, basically.
Yeah.
That one comes back a lot.
Right. Okay. Any others that?
I mean, any other? I guess weight, kidney function. I mean, the one that I think people get sort of tripped up on, or the one that I always tell people to try to avoid, is the barium meal. So when we said that this was started out to screen for tuberculosis, the next big health problem they identified as being amenable to screening back in the 50s and 60s was stomach cancer. So stomach cancer is very, very common in Japan and Korea. And it's thought to be down to a combination of dietary factors, probably high salt, high nitrate diet, and high rates of Helicobacter. But for whatever the cause, if you're born and brought up in Japan, your risk of stomach cancer certainly historically was 10 times higher than that of an American, even like a Japanese American. It's not a genetic thing. So they started doing barium studies, which is where they'll give you some barium to drink, and then they'll give you something that makes a lot of gas in your stomach and kind of spin you around on a table. So what that does is coats your stomach lining with a layer of barium, which is quite opaque to X-rays. And then they'll shine a X-ray beam through you to sort of try to find your stomach, and then they'll take pictures. Okay. Now that's quite an old school study. And
sounds very old school.
Yeah. The reason that I tell people not to do it is if they're Westerners, their risk of stomach cancer is very low. So the pickup rate of anything useful is pretty small, but also it's a lot of radiation. Yeah. So a lot of people say they don't want to do the chest X-ray. The chest X-ray is pretty low radiation, actually. So I don't particularly care. I mean, I wouldn't worry about the chest X-ray one way or the other. You'll get as much radiation flying to Hong Kong as doing a chest X-ray. But the barium study is perhaps 300 chest X-rays.
Wow. Okay.
All in one go. Yeah. And if you're doing that every year, that's a fairly big dose of diagnostic radiation, looking for something that probably isn't going to be there. So you can make a fairly strong argument that's an inappropriate investigation for a Westerner. Plus, it's not even terribly accurate. So a lot of the time it comes back saying, you know, minor irregularity on the barium study.
Right.
And then you have to go and do a gastroscopy. So you have to go and do a camera to look at this minor irregularity, which quite often will turn out to be nothing. So, I mean, if I was going to do a full-scale Japanese medical, that's the one bit I would sign myself out of. And I know that people who've done that, the places that they go to don't like it. They don't like you saying you're going to, you know, cut a particular part. But there are some fairly good medical reasons for not doing it if you're a Westerner.
Right. Okay. No, that's very helpful. Are there things that aren't included in a typical annual medical check in Japan that Westerners should perhaps be looking to do separately, or as part of, like you said, these VIP type health checks? If there can be things, if there's things that can be included.
Yeah, I mean, sometimes they'll let you opt into extra tests, and basically, so we're just talking about stomach cancer because that's common in Japanese people. So, I mean, the picture's changing, but historically, Japanese people, very high risk for stomach cancer and relatively low risk for colon cancer, and Westerners the other way around. So Westerners don't get as much stomach cancer, but they get quite a lot of colon cancer. If you're a non-smoking European or American man, your sort of two highest risk cancers are prostate and colon. And colon cancer is really easy to pick up in early stages. So in the US, certainly, and increasingly in other Western countries, the move is to get everyone to do a colonoscopy to screen for colon cancer, probably at 50, or if you've got any risk factors, like if you've got a family history of colon cancer, maybe even at 40. But you would never get offered that on a Japanese medical. You'd have to specifically ask for it to be added in. They sometimes will do stool samples. They'll ask you to collect stool samples and bring them in, and those will be tested for occult blood, which is a sort of low-tech and slightly less accurate way of screening for colon cancer. So it's not that they haven't addressed it at all. It's just that the emphasis is much more on looking at the other end of the gut. So I guess if you've come from if you've grown up on a Western diet, you want to think about what's important to screen for, which end of your gastrointestinal tract is most likely to have cancer, and kind of pick the investigations accordingly. And then I guess there are a few kind of minor bits and pieces. I mean, there are a lot of interethnic differences. So if you're someone who's come from a part of the world where there's a lot of hepatitis, screening tests for hepatitis B and C might be appropriate. And if you're Caucasian, probably checking your iron levels, your iron stores, because there's a genetic condition called hemochromatosis, which is basically progressive iron overload because your body can't eliminate iron properly. There's a very simple, straightforward blood test to look for that, but I've never seen that included on a Japanese medical because Japanese people just don't get hemochromatosis. Okay. So it's not something they would ever think to put into a medical check here. Yeah. That's fairly small, that's fairly fine print. And I guess most people who've got a family history of hemochromatosis, like a father or someone, will kind of think of that and will specifically try to address it. But still, it's something that would be nice to be added in if you were a Westerner having a medical check here.
And for those people who don't have this as part of their company policy, so the company's not organising it for them, are there recommended medical centres that that you would suggest people go to? Do you guys perform the Japanese type medical check at Tokyo Medical and Surgical? Where should people be looking?
Yeah, I mean, you can really go anywhere. Most big hospitals will have a general medical checkup package, and some of the big hospitals in central Tokyo will have a service in English. They'll provide an English language report, and they'll have a certain amount of English spoken when you go through. So I mean, probably I guess if I was going to go and do a medical check, I'd probably go to St. Luke's. I think theirs is quite good. It's quite well explained. Of course, we do medical checks as well. We're particularly mindful of these interethnic differences. We're looking for things that are more common in Westerners. So we try to sort of tailor our approach to the people who we're checking up. So, I mean, you've got a lot of options. I guess the main thing is if you're going to a Japanese place, whether it's fairly high-end like St. Luke's or whether it's just your local hospital that's got a sort of more basic package, just be aware that you're not going to get a lot of explanation or follow-up on the results. And really the anticipation is that, if you're a Japanese person, you get the report, and if there's a problem, you take it to your regular local doctor. So you really need to have like a primary care provider or a local doctor you're comfortable with. So if there are any problems, you can take it in and discuss it with them.
Sure.
I think that's quite important, actually. So don't just do the check. Think about who you're going to call if there's a problem.
Right. Okay. That makes sense.
Yeah.
Okay. And is there anything else that you think that people should know about the system?
I mean, I think just be kind of, you're in Japan, and this is part of the Japanese kind of the Japan experience. So I think some people find it kind of quite intrusive. So a lot of people think, okay, I don't mind doing a medical check, but I don't really want the whole report to go to my company. And I mean, Japanese companies probably have a sort of sense that they've got a duty of care to their employees. So they actually want the report and they want the company doctor to look through it. But I've had some people who basically said, if they've got like a chronic medical problem like high blood pressure or cholesterol, they know about it and they want to take steps to manage it, but they see that as being separate from their life in the company. Because high cholesterol for almost everyone doesn't affect your ability to do your job normally. So I've had people work for larger Japanese companies who've had the company doctor phone up and say, what are you doing about your cholesterol? And they've kind of thought, well, it's none of your business. I'm going to look after that somewhere else. But I think you need to sort of remember that, if you looked at it from the Japanese perspective, if you're a Japanese person and you went and worked for a Western company, it might feel very uncaring that, they might send you for a medical check, but they wouldn't look at it or think about it. But you might feel that was quite sort of negligent. So I think just be aware that there's a kind of slight cultural difference in expectations there. And if you do find it intrusive to have the company sort of picking its way through your blood test results, you don't have to disclose the whole report to the company. So you do have the option, like let's say you work for a big Japanese car company and they've got a dedicated facility. So they say, okay, you're going to the Toyota medical check facility on this day and you're having a medical check. You can't decline to do a medical check, but you can say to HR, thank you very much. Actually, I'm going to do a medical check with a doctor of my choosing, and I'm going to submit a document from them. So I see a certain number of people who want to do a medical check with me, and they just want a piece of paper saying, this person has done a medical check, they are fit for employment, I have discussed their health issues with them. But then there's no content.
Okay.
And they'll just give that to HR, and then HR can put that on file and say, okay, that person's done the medical check, they're off the list. And of course, they'll get the report as an individual and they'll know what's wrong or right with them. But it won't kind of go through the same granular process within the company. So I think just be aware of that and be mindful of that. And if you do decide you don't want your medical records going on file with HR, there are some things you can do where you'll still comply with requirements.
Okay, that's very, very helpful.
Yeah.
Okay, well, I think we've covered all the main points there. That was really useful.
I think one more thing, actually, one more thing I wanted to say is, I think there are some big positives in here as well.
Yeah.
So I've kind of sometimes sounded like I'm kind of bashing the system or saying, it's not very communicative, it's clunky, it's automated. But there definitely are some big positives. And particularly if you come from practicing medicine in a country that doesn't have a medical check system like Australia or the UK, I do see guys in their 50s who've got quite a bad health, but have just never really looked at it or thought about it. So particularly as you get into your 40s and 50s, the system does make you address healthcare concerns that you might not find otherwise. So, having said that it's clunky and it can be inconvenient, there are some definite positives as well.
Yeah. Okay. Well, I think that's a good note to end on. Thank you again for taking time out of your busy schedule. It's much appreciated. And we'll look forward to chatting again with you soon.
Great. Thank you very much for having me. Speak to you again soon.
All right. Thanks, Tom. Bye.
Cheers.